Step 21, instructions. So when you see fertility specialists, they mainly focus on clinical side of IVF, but you still need to understand IVF cycle in order to go through this treatment. For that, you will speak to normally nurses who explains IVF before you start the cycle. So then you can receive this information verbally, written, on video, and on top you will speak to one of the nurses. They go into detail and explain IVF step by step. First thing they explain is communications. So in terms of communication, they explain how you can communicate with clinic admin, nurses, and specialists, and how clinic will be communicating with you. So I really need to find out whether you should expect telephone call from the clinic, or text messages, email, and also you need to find out how you can reach the clinic during office hours, out of hours, and during emergency. So, and that's very key, so that you reduce the stress when you're going through the IVF treatment. Then you will have a full explanation of the cycle from beginning till hopefully successful pregnancy. So here that's called cycle review. So that includes all the baseline stage where they explain where you will get your drugs, and all the forms for the blood test, and then they move on to explain ovarian stimulation, egg collection procedure, egg fertilization, embryo development in the lab, embryo transfer, and luteal phase support. So then very importantly, you should really clarify how you initiate your cycle. Generally there are two ways. One, in some clinics set up the cycle using pills, and then they will contact the patients when time is right. In other clinics, wait for patients to contact when they have a menstrual period, and by doing blood tests, which is called baseline bloods. So you really need to find out how you will actually initiate IVF cycle. That's very crucial. So then next is injections. So that's very critical, because we rely upon injections to stimulate your ovaries so that eggs can be grown and collected. So those injections should be given on right dose and right time. So then you will have a full explanation of each injection, and the timing of the injection, and technique how you use those injections. So then next is the cycle monitoring. So you need to have a monitoring of your cycle by doing ultrasound scan and blood tests, and you will have full explanation of where you should go for the blood tests, and where you should go for ultrasound scan, and approximate timing of the blood tests and scans. So also you will get instruction on not to have unprotected intercourse during IVF treatment cycle, and your partner will get instruction on abstinence. You normally need to abstain. Your partner needs to abstain 2 to 3 days before egg collection, before he provides sperm on the day of egg collection. So this is very critical, trigger injection, because trigger injection is critical in terms of its timing, because if you give injection too early, then it will be too late to collect the eggs, because you will have ovulated by the time of egg collection. Or if you give too late, then it will be too early for the egg collection. So this is why the trigger injection should be given exact time, and that will be explained. So if you are not sure, you really need to clarify which one is a trigger injection, which one is a stimulation injection, which one is antagonist injection. So next is egg collection. In order to reduce the stress level on the day of egg collection procedure, you should have full understanding of fasting, full understanding of admission procedures, actual procedure, and recovery after the egg collection. How long you will stay in the hospital, and how you will be followed up after recovery, and what you should expect in terms of symptoms after recovery after the egg collection. So next day after the egg collection, you will normally receive phone call or email or text message regarding fertilization. How many eggs were collected, and how many of those eggs fertilized. And again, you need to clarify what fertilization means and how it will be communicated to you. Next is embryo culturing. So After the fertilization, you wait for 5 days until your embryo has grown to the blastocyst, and then you will be explained what happens during that stage and what you should be doing while waiting for that. So normally you start progesterone during that period, and you need to understand exactly of starting progesterone. So that's called luteal phase support. You should really find out when you start progesterone, how you use the progesterone, in what dose, and then how long you stay on the progesterone. So the next is embryo transfer. Again, to minimize stress on the day of embryo transfer, that's very important step. You will need to have a full understanding of how you prepare yourself for embryo transfer in terms of emotionally and mentally. So embryo transfer is a critical stage. You should really minimize any stress. You should really have a good experience of the procedure. So that's why you need to really understand all about procedure in terms of when you will be having embryo transfer, how the procedure is done, and then instructions on admission for the procedure. So essentially you need to have a full understanding of embryo transfer, which need to be explained to you before your IVF treatment cycle. Then you do a blood test approximately 10 days after the transfer, and you need to understand what those blood tests mean, what positive test means, what negative test means. Hopefully you will have a successful treatment. Then you'll have ultrasound scan at 7 weeks of gestation, and then you'll need to be explained where you will attend for the scan, whether you're going to come to the clinic or you go to the imaging center for that. So yeah, so understanding, having good knowledge about IVF before you actually start the IVF treatment cycle is very critical in terms of minimizing your stress when you're going through the cycle, so that you can really focus on your medical and emotional well-being during the treatment. If you're not sure about at any step of your IVF, you shouldn't hesitate to contact your clinic and clarify. And of course, during the IVF, you will be guided through by nurses, by admin, by lab team, by your specialists, but still having good understanding before actual cycle is critical in